Hi, I'm Janelle Friesen. I'm the Public Information Officer with the UG Public Health Department. It is August 20th, and this is our COVID update video. I'm here with Brandi this week. Do you want to say hello?
Good morning. My name is Brandi. I am the COVID Mass Vaccination Site Lead here in Wyandotte County. We are currently at 78th and State in the old Kmart building. Prior to coming to this role, I was a vaccine and pharmaceutical researcher for 20 years and came to join this team here in March to help lead the charge against COVID.
All right, great. And I'm really glad that you're here to talk today about this topic because we're talking about third doses of the COVID vaccine. I know there's a lot of confusion right now because recently we started offering third doses for people who are immunocompromised, but we're also hearing news about boosters coming just in general later this fall. Can you talk a bit about what's the difference between those and why are those things happening separately?
Sure. I think it is important that we differentiate what is a third dose versus what is a booster. So first, we'll go over boosters in the traditional sense. Boosters in the traditional sense are because we have waning immunity over time. So say we have a tetanus shot. We know that every 10 years or so, we need to get a tetanus shot because our immunity starts to go down. There is a level by which that we want our immune systems to be functioning at to be protective against us. So boosters in the traditional sense will come later. Those will probably be anywhere from 6 to 12 months after your second dose. The dosage may be a little less. It may be the same. It could be a little different. We're not sure yet. It's looking like it'll probably be in the 8 to 10 month range after your second dose for the general public. Now, third doses, those are really for about 3% of the population. Those are for us that are immunocompromised, either moderately or severely so. We're looking for people that are having active chemotherapy, active treatment for blood cancers, solid cancerous tumors. Those of us who have conditions like rheumatoid arthritis and are taking medications for that, also our organ transplant recipients. So people who have moderate to severe primary immunodeficiency, those are really the people that qualify for this third dose. This third dose is the same dose for Pfizer and Moderna as you would have had the first and second time. There is data to show that with the first and second immunization, these individuals don't quite get to that level of immunity. So we added a third dose in the studies, 28 days after the second dose in each series, and found that people did get much closer to that level of immunity that we were looking for.
Okay, so if you have something that, whether it's a health condition or a medication that significantly weakens your immune system, you don't get that initial level of immunity, and this brings it up versus.
Correct. Yep, that's exactly right. So with the first two doses, you don't quite get, because your immune system can't make the antibodies the way that somebody with a robust, healthy immune system would. So it just took that extra dose to get you to where we wanted you to be. So really, it's a 3-dose series for people that fall under these guidelines.
Okay, thanks so much for explaining that. I think that a lot of people have questions about that right now. So if you are someone who is moderately or severely immunocompromised and you want to come into our Kmart site for your third dose, how does that work?
So you can come in at any time. You're welcome to come in without an appointment. During our hours of operation, we're here from 10 to 6, Wednesdays, Thursdays, and Fridays every week. All we really need is your vaccination card, your previous vaccination card. If you were vaccinated in the state of Kansas, we can help you look that up. But certainly if you were vaccinated elsewhere, it's a little more difficult for us to find that information. So in order to be prepared, please do bring your vaccination card with you. We do have a self-attestation form. So you have to self-attest that you have one of these, that you fall under one of these 6 guidelines for people who qualify for this third dose. And we're happy to walk people through it if they have any questions. You do not need a note from your doctor. We don't need a prescription. I've had a lot of patients coming in and asking me, do I need to bring a note? You absolutely do not. You just have to self-attest that you have one of these conditions.
And how long after you had your second dose do you come in?
So 28 days after your second dose is when you qualify for this third dose.
Okay, and this is if you had Pfizer or Moderna.
Correct. I think it's important to note. So if you, this is only for Pfizer and Moderna. We don't have any guidance on Johnson & Johnson yet. So also, if you had a first and second dose Pfizer, you'll need a third dose Pfizer. Or if you had a first and second dose Moderna, you will need the third dose Moderna.
Okay, great. And we have those at our site, but people can also search by manufacturer at vaccines.gov if they are looking for another location.
Yeah, vaccines.gov is really great for when we're not on site. You can go there and you can filter places nearby by a radius search, and then filter even by vaccine that you're looking for. And it will tell you the hours of operation for the places around you that have those vaccines.
All right. So I think this really helps to show how it works with those third doses. And it sounds like this is a pretty important way to protect folks whose immune systems may put them at higher risk from COVID. What else can we do to protect those individuals and other folks who are at higher risk?
It's important that we still keep masking, keep social distancing, keep washing our hands. You know, I would really like to see people go back to the mindset of where we were really protecting ourselves back in January, right? When these vaccines were first rolling out, people weren't getting vaccinated or weren't able to get vaccinated right away. I think it's important that we continue to do just those personal protective measures that we know to be helpful and working.
Yeah, and you know, if you have somebody in your life who maybe is immunocompromised, or maybe you have kids in your life who are under 12 and can't get vaccinated, if you get vaccinated, that doesn't just help protect you, it helps protect them as well.
It absolutely does.
All right, well, I think we can go ahead and wrap up for today, but thank you again. We just want to remind folks that they can get COVID vaccines for free. And you can see our latest hours and other information and resources at wycovaccines.org. Thanks.
Thank you, Janelle. Thank you, Mitch. Thank you.